This is the Fix Your Sciatica podcast.
So with the holidays or the holiday season, I know that for me, when it comes to just trying to manage my energy, it can be pretty tough. And right now it's just me and my wife and my 15-month-old daughter. So we don't really have too many places to go. But in retrospect, looking at what it was like before we had our child and even just living close to family, it can be really exhausting. And it got me thinking about how does fatigue and in essence, the concept of burnout put us at risk of developing pain, but also how does that prevent us from getting out of pain as well? And rather than you listeners listening to me just talking, I thought today's guest is particularly qualified to discuss it because not only is she a physician and anesthesiologist, high stakes stuff, but she is a mom and also coaches other physician moms on how to manage this burnout status. And so today I have Dr. Cindy van Praag, who is amazing and brilliant. And I met her a couple weeks ago, and she was really kind enough of sharing her expertise when it comes to burnout, given all the responsibilities that we have in life. So Dr. Cindy, it's so great to see you, and thank you for being on today's episode.
Thank you. Thank you for the invitation.
The pleasure's all mine because number one, I saw this really funny image or meme on the internet the other day, and it was like the reality of fatherhood is realizing no matter how little sleep you get as the father, the mother always has worse sleep. So then I thought that was just very funny. I was like, a very accurate thing, and I was just thinking, how can we tie this in? Now, I've been an athlete my entire life. When I was in college athletics, we were talking a lot about burnout. Luckily for me, I wasn't burned out, and I have experienced some levels of burnout or gotten close to it, but my life is a lot simpler than a lot of folks. And so let's talk about this concept of burnout. I think a lot of people, they're like, I'm burned out. Like, let's talk about like setting the stage and just describing like what it is. And especially from your perspective as a physician, working with physician moms too, what is burnout? How can we describe it?
Yeah, good question. Physician burnout, specifically for us, the doctors, is really something chronic. So it doesn't just happen overnight. And I'm really glad to hear that you didn't burn out in your training. So I applaud that. But out of the gate, doctors are very driven, right? We have this need to compete, to achieve. We're also very resilient. So doctors can go a long way in their career, advancing the career, starting a family, having children, piling on all the responsibilities. And that in itself is a lot for a person, but you do all of that in the context of the medical system, which over time is getting more difficult to work within. And you have a perfect setup for burnout. And in this medical system, physicians are losing their autonomy. They're losing control over their schedules. They're not having time to see their patients and give the care that they want to, and they're exhausted. And then they go home and they have these, especially physician moms, you have these little toddlers running up to you and you're exhausted. And it just perpetuates the chronic stress and exhaustion and eventually burnout. So the term burnout is chronic and it occurs from outside sources like the system, like medicine. It occurs from like interpersonal demands, your commitment to your family, and it occurs from things within us, which is our drive and our need to succeed and compete and achieve. So it's a combination of all of these factors that can really set somebody up for burnout.
And thank you so much for sharing that. And I really appreciate you talked about resiliency. This is not a question that I shared with you before, but it brought up another concept of, I just think about, so my physical therapy school education, very different than your medical training, because with your medical training, not only do you have your 4 years medical school, you have your residency, and then you go on, some people go to fellowships or even specialties as well. And so there's a lot, not only just from like a length of time standpoint, but also the amount of time that you put in during those years. This question that really came to mind is, do you think that the resiliency was always there and that's what allowed doctors to go through their medical training? Or was it the medical training that they went through that has built up their resiliency?
Yeah, great question. My first inkling is to say it was built up during the training. The training turns you into a different person between medical school and residency and fellowship if you do that. And you are just taught to suck it up, to get through things. You're taught to deny yourself basic physical needs, mental needs, emotional needs. And just little by little, yes, I think you're taught how to keep pushing through and not let it pull you down. And I guess if that's how you define resiliency, yeah, we get really good at that.
I have said this about every doctor that I've met, every physician that I've met, that you guys are absolutely brilliant and you're like absolute workhorses. It's amazing to see, especially from my end. So let's talk about like that chronic buildup of stress, of things that really pile up, because yeah, there is going to be a point of exhaustion. So let's talk about what the physical toll, how does that present itself when someone is burnt out, especially being a physician?
Yeah, burnout absolutely affects our bodies, and it makes complete sense, right? It's chronic stress, and everything that the body does to deal with chronic stress is inflammation, and you have hormones going up, and they're maintained at this high level with chronic stress. Not to say that stress is bad. Stress is good in life, especially short-term stress. Like if I had to get up and give a presentation or come on to a podcast interview, you're a little bit stressed, but that's good because your body does create those hormones, and that sympathetic nervous system fires up a little bit and it gets you through and it's very productive. But then that stress, you finish, that stress goes away and your body has a chance to recover. So the difference with chronic stress and burnout is that you just don't get the chance to recover. You're in that constant state. So you have these hormones, you have cortisol, you have inflammatory markers, substance P, you have all of these physiological things that really are happening. You're not imagining it, and they stay in your system and they do have an effect long term. And so that would be, you could have physical symptoms. You could have, before you even know that you're burned out, you could have GI symptoms, you could have stomach ache, you could have nausea, you could have irritable bowel, your bowels just isn't functioning right. You could have headaches, you can have pain. And I think that a lot of these minor things are easy to ignore, and at least I'm speaking as a physician. You just kind of push through them until they peak. And pain, wow, that is the biggest signal that something is wrong, right? It is a powerful wake-up call that something has to change. And it's this messenger that opens your eyes to what's going on. Am I in pain because I hurt myself? Well, no, not really. Maybe it's your lifestyle. Maybe it's the burnout. So it absolutely affects your body.
I really appreciate you bringing up how stress is actually a good thing, because I feel like we as a society transition from like a point of, we won't even call it like not enough stress, but like we realize as a society that we are going through a lot, like especially with social media and just being aware of everything. Life is really stressful. And what ends up happening is people think, well, I need to go to the exact opposite. I need to not have any stress. And so the stress is really a large part of our survival and our evolution. And it gives us an opportunity to be able to live in a world that we're at today. But you're 100% right to that recovery. And one of the biggest questions that I often ask my patients and my clients, especially when they've been dealing with pain for such a long period of time, is how is your sleep? And that actually provides a huge window into what is going on in their lives. Now, the big question that I have to determine when I'm working with my patients as a physical therapist is to make sure, are they not sleeping because of the pain that they're in? Which could be in some cases that's the scenario. If that's the case though, we then talk about strategies to make it so that sleeping isn't as painful. But if they've been sleeping horribly prior to their pain, that says, all right, well, their lack of sleep, their exhaustion can actually make them a little bit more sensitive to pain. And especially what we found in the chronic pain stage or the chronic pain world is that when you have sleep deprivation, you're going to be much more in tune with the aches and pains, but even more so like the nerve type of stuff as well, because your nervous system is kind of shot. Now, let's talk about the data, right? We live in a world where we have so much access to data of ourselves, right? And so for you, when you're working with your clients, are there specific tools or measurements that you use that helps you gather objective data in regards to burnout?
I don't use, and you might be alluding to like wearable data, like my Apple Watch. I use that. I have a group of women that love the Oura Ring. I don't have it, but they swear by it. And so those tools, if they already have them, yes, I will bring it into the coaching situation, but I don't tell people to run out and get it. I think that those tools can be especially helpful to track trends, especially for people who really are into data and feedback. And let's say they want to make a change in their habits and they want to see how it affects their body, in a way they can't see. They're really fun. It's almost like gamifying your health, right? Because you do something positive and then you see what positive change you can get through the data. It's, for example, my son goes to school and his college is in a very high elevation. And just this morning, it's so funny you're asking this, he texted me, he said, "Mom, my resting heart rate is different." He gives me a screenshot. He said, "Look at my resting heart rate." And it says he's been home for 5 days for Christmas. We're Christmas now. And it's dropped about 9 points. And I'm like, I am fascinated by that data. And he's like, is something wrong with me? I'm like, no, nothing's wrong with you. But it's the trend, right? It is so helpful to make us stop and get curious about what's going on. And the key part about tools that we use, like a watch or a ring, is they don't diagnose. I can't say, "Oh my gosh, if I wasn't a physician, you might have something wrong with your heart. Let's run to the doctor." It doesn't diagnose a problem. So you have to look at the context. So the context for him in this example of his heart rate is one would be elevation. So when you're at a higher elevation, is your heart rate higher? Maybe because the oxygen the concentration in the air isn't as high. So maybe your heart's working a little faster. Maybe he's more active at school because he's walking between all those classes and doing a lot more activities at the gym. So the average heart rate would be higher. Maybe he's sleeping better at home, so he gets into a deeper sleep, and it would be. So anyway, I could go on and on, but the key is that there can be multiple reasons why those tools can give out that data, and it might not be something habit related. It could be an underlying health problem. So I would always encourage anyone who has a concern in the data that they get to talk to their doctor. Make sure it isn't an underlying health problem, heart problem, thyroid problem, anything. Am I dehydrated? Just anything? That list is very long. Not to worry people, but if you see something that concerns you, just check it out with your doctor too.
100%. I was an early adopter of the Whoop strap that came out maybe about 15 years ago. And it was so cool. And I used it for a certain period of time. And there was a point when using that where I got a little too obsessive over the data itself. And it made me realize, well, if you like to have the data as a way to just add some more context into your life and your behavior patterns, 100%. But if you're someone where you're overwhelmed by data, or you feel like you really fixate on the data, it can create a little bit more harm than good. And now I personally use the Oura Ring, which I really like because it just helps me keep track of the activities that I do. And also it helps me like confirm that I know that alcohol doesn't agree with my system. And so if I were to have a glass of wine, because here we are living in Northern California, if I'm going to have a glass of wine, I'm going to have a glass of wine at like 3:00 versus a glass of wine at dinner, because as you know, with like having kids at home, you want to make sure that you have the best sleep, right? So that's the most important part. Let's talk about the physician mothers, the physician moms, right? And burnout itself. It's really easy to just like push. It's really easy to take everything on by yourself, right? So let's talk a little bit more. Yeah. So in regards to burnout, like why is it so hard for physician moms to prioritize like their own self-care to prevent the onset of burnout? Even when they, clearly see, being a physician, you can see the risks associated with chronic stress, fatigue, and burnout.
Right. If only just having the knowledge could prevent burnout.
Yeah, exactly.
Right? It's a great question, because why would you keep doing something that harms you if you know it harms you? Excellent question. And I think it's something that's inherent in their nature, which is to help other people first. And that overrides the knowledge that what they're doing can be harmful over time. And so physicians are driven to help others. And also as parents, and this relates to all the parents out there, that I don't think would argue with me that you put your kids first. If parents that don't have enough food in the house, they let their kids eat first before them. Or you get your kid to sleep before you get to sleep. Or just any number of examples. So that's out of love and instinct. So you combine your love for your children and putting them first, along with your inherent nature to help other people, which is your career. And that's most of your day, right? It's hard to fit in prioritizing yourself when you are doing all these things for other people. But it can be done. It just takes a little effort sometimes.
Yeah, it's unfortunate that we have only 24 hours in a day. If I know that you physicians are working really long hours, you're seeing I'm assuming you're usually 10 to 12 hour days on top of the multiple patients that you have to see. So when it comes to trying to fit, so would you say that when it comes to trying to fit in moments of self-care, do you find that it truly is a logistics issue in regards to there truly isn't enough time in the day? Or is it more of a perception issue where physician moms, anyone who is really overwhelmed, they take a step back, they're like, I really don't have any time. Yeah, is it a true logistical aspect, or is it more of a perception aspect that's stopping them from even just fitting just a little bit of time for self-care?
It's actually a little bit of both. So if someone says, I don't have 15 minutes to devote to maybe physical therapy, right? I don't argue with them at all. Maybe they really don't have 15 minutes, and that's logistical. But what I do is get curious. And I get curious about how they make their schedule and what they're prioritizing. So what are they motivated to do? So I might ask a hypothetical situation. So, okay, all right, let's say you need to do this. I had physical therapy recently. I'm still doing it, but it's 15 minutes, right? And so I didn't have time for it, but I made time because I prioritized it. The hypothetical I ask people is, okay, what would your life be like if you don't do the physical therapy and you just keep going status quo? How are you going to feel in a month, 2 months from now? And it's usually not a great answer, right? Their pain's probably going to get worse. They're going to be uncomfortable. They'll be disappointed in themselves. Okay, so now flip that. Well, how might your life look if you did get that 15 minutes in? And man, maybe I could get up. Maybe I wouldn't, groan when I walk across the room. They imagine what it can be like, which is really what it can be like. And so what that scenario does is kind of reframe their mindset into what they want to prioritize. And once you start prioritizing that 15 minutes, it doesn't sound like much, but they're prioritizing their health and they're valuing their health over all these other things, then that's a change of mindset, right? So then they start thinking, okay, I'm going to prioritize that over my schedule over here. So it's often not exactly about time, it's about what people prioritize. And when you're exhausted and burned out, another point is that everything's so hard, right? You're so tired. Everything takes longer, and things, you slip up, you don't sit. It's just everything's a struggle. But think about those days when you do have energy and life is awesome. Things just seem to kind of click into place and you have more time because you end up freeing up time that you're not, dragging through projects exhausted. You're getting them done faster. And look at that, you have more time. So what I help these women do is work on what they value, which means what they prioritize. And once they start doing that, we can start working on small habits to increase their energy. And when you increase your energy, things just get done more efficiently, and then more time pops up. So it's a little bit of both. I like how you framed your question because logistically, right, it might not be there. But when you change your mindset, then you can find the time.
This episode is brought to you by the Patient Advocate Program. Are you tired of not having support between your rehab sessions? Introducing the Patient Advocate Program, and we're focused on your recovery, and we're offering you 24/7 access to a doctorate of physical therapy. Stop waiting in line to be seen and stop spending hours doing long exercise programs. Imagine being able to get all of your care delivered straight to your phone. Best of all, it's affordable. We believe everyone deserves top-notch relief without breaking the bank. So why wait? Take control of your health today and visit ptpatientadvocate.com and book your free call with our experts.
it's in essence working with what we got, right? Working with what we have available, which I really appreciate. And I think for you, because you're a physician and a mother, like you know exactly what it feels like to have such a filled schedule. I think one of the challenges, especially when people hear the word prioritize, is that oftentimes they'll hear the word prioritize and they're like, well, who are you to say that I need to prioritize X, Y, and Z? And I think that you are particularly qualified because of the workload that you put on your shoulders. The way that I work with my patients, especially if they are really busy, is I call it like movement snacks, kind of like, or like in California, we call it microdosing, but kind of sprinkling throughout the day. But especially with the population that I work with, people who are dealing with back pain and sciatica, is not only just the exercises themselves, but also how they go about their day. So it's really saying you don't necessarily need to do more, but we're going to shift our focus to walking this way or bending over this way. And so trying to find ways to make it work for them, because you're absolutely right. Like people are so busy. I didn't realize how not busy I was until I had my kid. And then I'm like, oh, this is what people are talking about. And I know it's going to be very different when I have second, third, and all those other things. And obviously it will change when they get a little bit older too, right? So the majority of the time we're in a constant state of change, which is good, with those ebbs and flows of consistency. So let's talk a little bit more. One thing I didn't get a chance to say is what are, and we might have talked about it before, but what are some of those signs that people should be looking for where they're like, oh, I think I'm getting pretty burned out? Because usually from what I've learned, especially as an athlete, is like when you start to notice the signs, you're already in that state of burnout. But what are some things that listeners should be looking for to help just give them a little bit more clarity in regards to, am I in this burned out state or the beginning stages of it?
Right. So, like I mentioned, burnout is chronic, or in the medical world, we call it insidious. So it sneaks up on you. And so some of the signs could be, and I'm taking this more from the physician perspective, it could literally be your spouse or significant other or your partner like coming to your face and saying, hey, do you realize how you're acting? And you probably don't. And that's one sign. And I've had that before and I've ignored it, honestly. And I moved on and I just kind of thought, oh, they don't know what they're saying. But it's a sign. And if you tune into it, it might be there. And then you have physical signs, right? You have, like I mentioned earlier, like the GI symptoms. You could get in your car to go to work and you have a dread in your stomach, or you just feel like nauseous, or you have the, like the Sunday blues, I think they call it. You're going to go to work the next day and you're just this feeling sinks over you, or you have pain, or you have tension, or maybe you're coming home and snapping at your kids more. Like you notice that, oh my gosh, on days that I work, I come home and I snap at my kids, and then I feel guilty for snapping at my kids because they just want their mom. But on the weekends, I never seem to do that. So that's a sign. So it's your interaction with other people, it's people telling you how you're acting, and it's also things that you feel in your body. And all of these little things, if you take them individually, might not mean anything, but when you put it together, it can paint a picture.
You brought up another very interesting question in regards to is burnout, or can burnout be diagnosed in like through your community? Like is it something where people like identify, okay, I'm burned out, and then they're like, I'm burned out? Or like are physicians such as yourself or like your peers, like are there people who will just literally say, wow, all this data will point to the fact that you're burned out? Can you tell us a little bit more about that?
I think declaring someone burned, I don't think it comes from someone telling you you're burned out. I think it's you have to decide for that yourself. It's not that a label you can give somebody, but there are certainly a lot of all the things I just mentioned, along with some other ones, including being cynical. I wanted to bring that up too. Very, very, very popular in medicine is being cynical about things and wondering how that part of your personality seem to have changed. So I think you need to come to that realization on your own. Others can help you by talking about it, but I don't think that it helps to have someone label anybody as you have burnout.
No, that makes a ton of sense. And I was originally going to say like, oh, it could be invisible, but you can actually have people who are around you being like, yeah, you're not yourself. And like, it is important for us to be able to take a moment and just reflect, like, how am I feeling? Which brings up another question in regards to when it comes to like self-checks, in regards to like, how am I feeling? I know that for me, I Actually, no. I know for me, I've had that my entire life because I was an athlete. So a lot of how I felt and my athletic performance made me really reflect on how I was feeling during all these things. So it was kind of like a learned thing that I've developed I lost my train of thought. But it really, the big question is, do you believe that like being able to do like self checks, do you find that it's like a learned skill? Is it something that we often have innate in us? The clients that you work with, is it something that people ignore? Like, tell us a little bit more about what those like internal checks are like.
Yeah, I think you ask if is it an innate skill or something you can learn. I think everyone has the ability to do it. It's a skill, but it is something that you can improve. And I help clients learn to strengthen this skill by first asking them to pause. That's the most important first step. And pause, and then I introduce them to mindfulness without saying the word mindfulness because some people might not like that woo-woo term maybe. But really it's pausing. I think we can accept that word. And taking a moment, and so this is what I might walk them through. Pause and take a moment and just take in your surroundings. What do you hear? Like right now I hear a truck driving by. What do you feel? Well, right now I feel the heat of the room. I'm in Houston. What do you taste? How does all of this is a non-judgmental viewpoint of what's going on. So then you're like, okay, yeah, this is easy. Now take that and turn that inward and use those same senses. What are you feeling in your body right now? Am I full from breakfast? What are you hearing? Can I hear the breath going in and out of my nose, my mouth? What are you feeling in your body? Is that, oh man, you know what? My neck is kind of tense. That's tightness. And you observe all these things without judgment also. So it's a non-judgmental moment of pause. And that builds the skill of awareness. And awareness is key for taking a step towards change. Once you are aware that you have these feelings in your body and that tension here and that knot in your stomach there, then you can do something about it. Now it's on your radar.
That's awesome. I'm so glad that you walked us through that process because people will see mindfulness and they understand that mindfulness is really impactful. But two things. One, it's like, okay, well, mindfulness, it's important. And it's like, yeah. But then the next question is like, well, how do I do it? Right. And so to be able to go through that step-by-step process is huge. You brought up a really important concept, especially as you're walking your clients through this, is the importance of the people that you're around or like the conversations that you have. Now, listeners, this is not me saying like ditch all your friends and ditch all your coworkers, but it is important to be able to get connected with someone who can actually give you that moment of pause. Listeners, Dr. Cindy is a perfect person to be able to converse with and give you the opportunity to be able to see what are you experiencing at this time. I'll work with my patients and I communicate with my patients on a daily basis because I find it gives me the opportunity to get the information that I need to be able to do my job better. And so what that means is if I send a message to someone, I'm like, hey, how are you feeling? And they're like, well, I'm in more pain. I do a little kind of my version of a mindfulness exercise because when someone says I'm in more pain, I can't really get that much information from that specific statement. So I'm actually walking them through, okay, well, walk me through your day. The pain is a little bit more intense. Where is that pain? What did you do differently? And we start breaking it down and we approach it from a period of curiosity, which I appreciate that you brought up. Because when we approach things from a pure point of curiosity, which I think that you do a very good job of doing, Dr. Cindy. But when we approach things from a point of curiosity, everything starts to become less scary. And in essence, when it comes to the pain that we deal with on a daily basis, pain is a very important sensory input that we need to protect ourselves. In essence, it was protecting us from things that are going to hurt or kill us. So it's a very realistic thing. But when we experience pain in the absence of an actual threatening stimulus, that's where it becomes abnormal. But what ends up happening is like if you are approaching things from a position of fear, everything is stressful, scary, overwhelming, hence will make your pain a lot more. So thank you, Dr. Cindy, for being able to say, this is how your mindfulness practice works and starts breaking down, making it a lot more approachable to that, which I think is much more important than the exercises that people do in physical therapy. Like the reality, like our jobs as physical therapists is like, yes, to teach you the exercises, but it's really mostly the exercise selection and how you go about doing things, but we can't figure out what needs to get done if we as a profession aren't getting that accurate information from you listeners. So that opportunity of mindfulness is huge when it comes to that. So again, thank you. That's my long and extended thank you for sharing that. Let's talk a little bit. I think especially like our generation right now, like recognizing boundaries, saying no to things. Like when it comes to boundaries and saying no to things and just the shift in priorities, you talked a little bit about it earlier on, but how important is that to shift the priorities? And how does someone go into shifting priorities and starting to just say no to things?
Yeah. Oh, that's a big topic, boundaries, which we could talk about for an hour, but I'll keep it very brief. How do you say no to things? Well, you have to figure out what to say no to first. And that does go back a little bit to what I was talking about, what you're prioritizing. And again, I don't like to use that word prioritize. I like to just lead people to understand what their values are, and they realize this is what matters to me. It's my health. It's that my kids. It's that I want to see my kids graduate high school. I want to see my grandkids. I help people center on what they value, and that can help you determine what to say no to. And that means you can say no to things that don't fit on your values list. So let's say you have 3 or 4 top things and you're going through your day and someone, a couple people are asking you to do all these different things. And you can pause and say, does that really fit in with what's going to help me achieve what I value? Is it going to help with my health? Is it going to help me get more time with my kids? Is it going to help me just any number of values, right? And if it isn't, then you can say no and not feel guilty about it, because you are saying yes to the things that go towards your values. Another difficult thing with boundaries is saying no to things out of guilt or feeling obligation to say yes to something. And again, that comes back, that's really hard. It's your good friend and they want you to help them do something and you just feel obligated because they helped you last time and you kind of owe them one. But it could mean something that's going to harm what you really value, your time with your family or your health. And so that comes back to prioritizing what matters most. And so that can take time to learn how to say no to these things, how to say no to the things that you're doing out of guilt, obligation, or things that you just because you always say yes. So that's a tough one. And it takes time to work on it. But once you prioritize what you really value, it gets a lot more clear.
I also find that having a young child to be really helpful to say no to things because I'm like, I can't, my baby's going to sleep now.
Yeah.
But I think what is really the heaviest part of what you shared, or the heaviest in weight, is giving people permission to say no. I think we lived in such a yes society that it really leads us to being overstretched. And that ends up becoming extremely challenging. So thank you for giving people permission to say no to things that don't serve them. It's extremely important. Now, let's talk about the work that you do, right? Because ultimately, like this podcast, people listen to podcasts for like one of many reasons. Number one, that they're just primarily auditory learners, but also another reason why people might listen to podcasts is they might just not have the time to read or look stuff up. So they much rather ingest things a little bit more passively, if I may. And so, which means that if you have a tendency to be a busy person, you might be a little bit more at risk of being burned out, or you might already be in that burned out state. So talk to us a little bit more about the work that you do.
Sure. So I love that you mentioned the value of podcasts and for busy people, because I love podcasts because I can do it while I'm doing my physical therapy. I can listen to an episode and learn something new. So I just want to give you a kudos for that. I love that. Thank you. The work that I do. So I am still practicing as an anesthesiologist part-time, and the rest of my time is spent as a physician coach for physician moms. And so what I do is I'm a non-judgmental thought partner that helps physician moms through these periods of life that are pretty tough, because they're very brilliant, successful women and have amazing careers, but they're working in this broken medical system and they have kids at home. And so I'm helping them navigate that period of life so that they do have the time and they do have the energy to thrive at work in their career and at home with their kids and not feel guilty about it. And that's done through coaching officially, but it's really just people have the answers within them. I don't tell anybody what to do. I don't label them. I don't dictate. I don't say you have to do this and that. But I do have skills based on science and psychology and neuroscience. And I do bring those skills into conversations and help people see they do learn these skills too, and the science behind it, and they learn how to change their life. And I had an experience with a coach that really changed my life, and I'm so much more healthy for it. It wasn't I'm perfect. It's an ongoing process, but I'm just so thankful for that. And so I just try to help bring that to other women. And then you don't need a coach forever. You can, what I do, you can just have it short term and just really kind of pivot your life and then head to a different direction. That's what I help people do.
Beautiful. And so for the physician moms who are listening and are at that point of their life where they need some help just getting permission to take care of themselves and get out of this cycle, what's the best way for people to get in touch with you?
The best way might just be my website, inspiredmommds.com. I also have a podcast if they want to listen to me while they're busy driving or doing exercise. And it's also called Inspired Mom MDs. And I'm on LinkedIn a lot. So if they look up my name, Cindy Van Praag, that would be my LinkedIn site. And you can reach out to me through my website or LinkedIn, and I will reply.
Listeners, I'm going to go ahead and put her contact information into the show notes, as well as the link to the podcast. Dr. Cindy, thank you so much for today. It was really insightful to be able to take a deep dive into the burnout world, especially as physicians. I'm so thankful. And it's not because it's the holidays that I'm extra thankful, but I'm particularly thankful for the jobs that you physicians do for everyone. And I know that the system is making things extremely hard for you guys, and you guys are the most brilliant and most resilient people I've ever met. And so it's, many thanks. And so again, listeners, I'm going to put her contact information in the show notes. So if you'd like to get in touch, please reach out to her. And yeah, Cindy, thank you so much for being on today's episode.
Thank you. It was so fun to be here. And I do want to give a plug for physical therapists because, as I mentioned, I'm getting physical therapy right now, and it opened my eyes to how much you have to know. So you guys are amazing too. And I really appreciate all the work that you do to help people move better and improve their pain and just get more freedom. I really recognize your contribution. It's a team. And so physical therapy is a vital part of the team. So thank you.
The pleasure, the honor is all ours. So awesome. Thank you so much for tuning in. We hope you got some help from today's podcast. And for more info, check us out at ifixyoursciatica.com. Have a fantastic and pain-free day. No patient-therapist relationship is formed by listening to this podcast. We are not providing medical advice, and all information should be confirmed by a medical provider.